Joining the ranks of 14 other states, the nation's capital will soon be the next jurisdiction to allow seriously ill patients the right to legally obtain and use marijuana, if a 10-year-old measure can take effect.
My name is Wayne Turner. I was the sponsor of DC's Medical Marijuana Initiative 59. Back in 1996, my partner Steve Michael and I were watching the election results from California when California passed the first medical marijuana initiative in the country. And one of the things that really struck us was AIDS patients were being kind of paraded in front of the cameras. People who were talking about medical marijuana were these political operatives in suits. And we come from the movement of AIDS activism, where people living with HIV and AIDS are their own best advocates. And so that began the first of 2 signature drives. The second one, my partner Steve, who had AIDS, started getting very sick. We gathered 20,000 signatures in the 5 weeks between Steve's funeral and our signature collecting deadline. And we got on the ballot.
But DC's unique lack of statehood would hinder efforts to advance the legislation.
Congress has authority over the district like no other jurisdiction in the country. So Congress has ultimate say over our budget and over our laws. Now, we knew going into this that Congress would be a problem, that this was a contentious issue.
In 1998, D.C. voters overwhelmingly passed medical marijuana. Nearly 70% of voters approved the measure, which is the highest initiative passage for medical marijuana ever. And then Congress added an amendment referred to as the Barr Amendment. Congressman Barr, at the time from Georgia, had an amendment to basically nullify the will of the people. So it prevented D.C. Council, City Council, to implement medical marijuana. And that was the case for 11 years until last month. And one thing that the Obama administration did, it said that they were going to respect states' rights. Very often, states that had medical marijuana laws on the books, or states that were considering it, kind of feared the federal government coming in and raiding their dispensaries. Not only did it please the states that have medical marijuana, but it made the states who are considering medical marijuana put them at ease a little bit, that if we do enact medical marijuana in this state, that we don't have to worry about the federal government stepping in.
For the past 10 years, we've been working in coalition with other organizations to try to have all of the riders removed from the DC budget, with the basic principle to let DC residents decide how we want to spend our own local tax dollars. We're not out of the woods yet in terms of our political process. Right now, the initiative is pending a congressional review. All DC laws are subject to a 30 or 60-day congressional layover period. Congress has a procedure where they can overturn DC laws during that layover period. But even once that layover period has expired, Congress can still step in at any time and overturn this. If we can get through this review period, this layover period, which should expire in the middle of March, then we're going to have to proceed very cautiously so that we can implement this initiative without raising the ire of Congress.
By analyzing other implementation models and learning from their mistakes, Turner stresses the need for extreme prudence.
I'm hoping for a public process, hearings with the DC Council, so that we can hear from law enforcement, patients, physicians, and from people in the community. We've waited 11 years to be able to implement this. We're not in any rush. Let's do it right.
As with all contentious social issues, there are many detractors who scoff at claims of the benefits of medical marijuana.
No drug is completely harmless, and we don't pretend that that's the case with marijuana as well. Research has shown it helps people who are suffering from diseases such as AIDS, cancer, MS, glaucoma. It helps relieve people's nausea, appetite loss. It helps people relieve pain. It's well documented, and this isn't just marijuana policy project saying that.
Our perspective was from the patient's perspective. We don't want to say, go ahead and try this, because, well, that's not our role. This is a decision that doctors and patients need to be able to make. And I think we can do it in a way that's respectful of the community and also respectful of the needs of patients.